AHRC COVID-19 Training, February 2021. Hi everyone, my name is Deanna Allen, and I am one of the two directors for the residential program along with Diane Burkett. I wanted to reach out to everyone today and say how much we appreciate all of you. The last year has been one of the most difficult we have ever seen. In that time, we have seen outstanding commitment and dedication from our staff. We are so very proud of our workforce and want to extend a thank you to all of you. The frontline workers at AHRC Nassau are the heart of the agency, and we will not forget that. I also want to take a minute to speak about COVID and the impact that it has on the people we support, our homes, and our staff. I know that all of you, from your own experiences, know how serious an illness COVID is. We have lost friends and family, and while some of us have been sick and lucky to recover, it is more important now, more than ever, that we stand together to fight COVID. After having been through the last year, we cannot let our defenses down. We must endure. We must work together to support each other and keep each other safe. This is not a one-man job. The people we support are counting on us. Our guys are incredibly vulnerable to this illness. AHRC takes the health and safety of our guys and our staff very seriously. We would like to take some time today to review some of the safety procedures in place to ensure that everyone remains healthy. Let's work together and kick COVID to the curb. Let's review some of the signs and symptoms of COVID-19. Cough, shortness of breath, fever above 99.9, sore throat, chills, loss of taste or smell, muscle pain, and lethargic. What do you do if you have these signs or symptoms? Well, the first thing you need to do is not come to work. We do not want you to come if you are not feeling well. We want you to take care of yourself. And we also want you to give a call to your supervisor to let them know that you won't be in as soon as possible. Please also call the COVID hotline at 516-686-4486 and notify them that you have signs or symptoms of COVID. Let's review screenings and logs. There are two different types of logs. There's the staff log and the visitor log. So screenings, when people come to the house, whether it be a staff member, a family, a visitor, an outside vendor, a clinician, everyone must be screened before they enter the house. This means at the front door before they step inside. Even if I come visit, please don't let me in. Screen me first. If a person has a temperature of over 99.9, they cannot come in. If they have signs or symptoms of COVID, they cannot come in. If they've been exposed to COVID, they should not come in per the visitor log. When we let people in without taking their screenings prior to coming in, we're essentially exposing the people we support to COVID. So we need to be diligent and we need to be very strict. And please, please, please screen before people enter. As we said before, if you don't feel well, please let your supervisor know. If you have signs and symptoms of COVID, please call the hotline and get some medical assistance. It's really important that the two logs are filled out correctly and consistently and neatly, because a lot of times what we'll do is if there's an exposure in the house, we'll pull the logs because we want to make sure that we're able to notify staff if they've been exposed to COVID. And if I can't read the names, it makes it very difficult for us to figure out who that person is. And also just kind of keep in mind, if you're doing screenings, please be sure to use hand sanitizer between each screening. So if it's the 3 o'clock shift and there are two people coming in, screen one person, use the hand sanitizer, and screen the other. Each individual has their own log as well. It's important that each individual has their own log, and it's important that it's done at least once a day, preferably in the AM, because if they wish to go out later on in the day, they have to have been screened prior and deemed in good health. If there's a case of COVID or suspected case in COVID, the increase in checks might be once per shift. Please make sure you touch base with your RN for further instructions if you suspect that there's a case of COVID in the home. The nurse will help guide us through what needs to be done and ensure that we are keeping people safe. In addition, we also have cleaning logs. Cleaning logs should be completed on every shift. Please pay attention to the manufacturer's required sit time for products, as they may need to sit on a surface for several minutes to be effective. This information can be found on the label. As you can see on the right-hand side of your screen is a copy of the log. We want to make sure that we are disinfecting commonly touched surfaces, such as doorknobs, light switch, faucets, telephones, etc. We want to make sure that there's hand sanitizer available in every room, and that you know where to get it should more be needed. If there's soap and towels by every sink, and that we have trash cans easily accessible for throwing away PPE after use. If you have any questions about how to get PPE or how to get hand sanitizers or need any assistance in this area, please reach out to your house manager or AD. So the number one rule for outings is that if the house is under quarantine, whether it be precautionary or confirmed, no outings can take place. So I'm going to say it one more time because it's really, really important. If the house is under quarantine, whether precautionary or confirmed, there are no outings to take place. If the house is not under quarantine, then the guys are permitted to go out on a limited basis. Transportation logs should still continue to be completed, and we should always go out in small groups. It's really important that when our folks are going out that they wear a mask. If they are not able to wear a mask, please touch base with your clinician before taking them out. Limit outings to 1 per day, per location, per person. Outings should be outdoors whenever possible and limiting indoors as much as possible. Please speak to your AD for approval for indoor outings. Keep in mind that hands should be washed prior to leaving and again upon return, and hand sanitizer should be kept in a to-go bag or even in the car if weather permits. Please note that all individuals must have their health check completed before they can go out for the day. For any off-site visits, it's important that the site not be under quarantine, precautionary, or confirmed. Typical quarantine periods are up to 14 days, and during that time, there can be no off-site visits. Additionally, if the home the person is visiting has any household members that is suspected or confirmed of having COVID, that also will need to be suspended until the 14 days, and we can ensure that everyone is well. The person must pass their healthcare screening and a temperature check immediately prior to leaving the certified residence. In the event that they are returning, we should screen them at the door, and if there's a concern, we should reach out to the nurse. If there's a temperature or they're not feeling well or you're made aware that they were exposed to COVID, please let your AD and your nurse know so we can set up proper precautions. The person supported must wash their hands prior to departing and then again upon return from the residence. And the families must agree that they're going to limit any large gatherings while they're home, per the New York State Governor's Office. An example of our off-site visitation documentation form is here on the right. Some things to keep in mind when filling out the documentation is that the person supported should have it completed prior to their leaving the IRA. A health screening and temperature check should be completed prior to their visit. A copy of the partially completed form should be provided to the family member and also kept at the residence. And the family member should be reviewed with the form so that they know the expectations of what will occur during their home visit. Family members must attest via signature on the form that they, as well as any family members in the household, have been free of symptoms listed on the form for up to 14 days. Upon return, the health screening will be recorded on the offsite documentation and will retain these records for OPW should they request it in an audit. Here at AHRC, we still welcome visitors to our homes. It's really important that visitation is suspended in the event we have a suspected case or a confirmed case of COVID. If that should happen and the house is under quarantine, there will be no visits during that time frame. There should be a sign posted at the door letting visitors know that we are not accepting visitors. When we are accepting visitors, there are a few guidelines to go through to make sure that everyone has a safe visit. There's a maximum of 2 visitors per person per scheduled visit, and those visitors should be over the age of 18. The visit must be scheduled with a house manager 24 hours in advance, and the visit should really be about approximately a half hour. Visiting hours at the IRAs are from 2 to 7, Monday through Friday, and 10 to 6, Saturday and Sunday. All visitors need to be screened at the door, and if there are any signs or symptoms of COVID present, they will be asked not to come in. All visitors must wear a face mask, and upon entry should immediately wash their hands or use hand sanitizer. If visitors are visiting the residence, there should be one bathroom designated for visitors, and it should be disinfected after each use. Visits should take place outdoors whenever possible, but also inside the house you can designate a common space or a bedroom, if it's a single bedroom, for visits to take place. There should be no food permitted during those visits, and everyone should observe proper social distancing. The one exception to our visitor rules is fire safety inspections. They will continue. If they can be rescheduled outside the quarantine period, they will, but if not, safety comes first and BK is allowed to enter the home. AHRC is proud to offer testing to our employees. Please note that if at some point in time you are exposed to COVID while working in one of our homes, you will be asked to be tested for COVID within 72 hours. You are welcome to get your test in one of our 3 designated locations. On Mondays, Freeport from 10 to 2, Wednesdays, Plainview from 1 to 5, and Fridays, Brookville from 10 to 2. When you enter our testing sites, please note that they are drive-up, so you'll need to bring a copy of your insurance card and your employee ID. Once you have your test done within the 72-hour time period, you have a week to submit those results to HR. Please note that if you use our testing sites, those results will automatically be forwarded to HR, and you will be given instructions on how to achieve those results through a portal. If you choose to go outside of our testing sites, please keep the 72-hour time frame in mind. And also note that you can send your results to the COVID-19 documentation at ahrc.org email address. If you test positive, you will need to call the COVID hotline at 516-686-4486. They will provide you with further instructions. If you test negative, you only need to forward your results to the COVID email address provided in the last slide. If for any reason you're unable to test in the 72 hours, please reach out to COVID hotline and advise. They will work with you to help you find a site if it's a concern that you can't get an appointment, and they will note individual circumstances and provide guidance. Please note that AHRC testing sites are confidential, and they will typically provide results in 24 to 48 hours through their portal, which you will be given instructions upon having your test done. So when do we call the COVID hotline? We call when we test positive for COVID. We call if we're traveling outside of New York State or the surrounding states. There's an opt-out option for quarantine upon returning that will be reviewed. Or maybe you live with someone who has tested positive. It's important to note the exposure and call the hotline for further instructions. When providing staffing for the house, it's important to avoid not a lot of crossover between houses. If you're working in a home that has been exposed or placed on precautionary quarantine or has an active case of COVID, it's really best practice not to float to other homes. If you're asked to assist a home that is on a precautionary quarantine or has a positive case of COVID, please reach out to your AD for further guidance and instructions. It's also important to let your primary house know of your intentions. This way we can all be on the same page and ensure the safety of the people we support. If you have received your vaccination, please let us know. We want to report back to OPW as per their request. So your vaccine cards can be emailed to COVID-19 proof of vaccination at ahrc.org, and HR will compile those numbers to send to OPWDD. The state would like to ensure that all of our staff who wish to have a vaccine have the opportunity to get it. So they're trying to track how many have it versus how many would still need it. If you're interested in a vaccine but are having trouble finding access to one, please let your AD know. We do have some instances where we have relationships with vendors that are providing vaccinations to the people we support, and in some instances, we are able to provide additional vaccinations to some of our staff. So please let your AD know if that is something you're interested in. We'll do our best to help. If you want more info on vaccinations, please let us know. We are happy to refer you to upcoming webinars and Q&As. You can also speak to our house nurse and our ADs for further information. If you have any questions or concerns, we're always there to answer them. The next portion of our training has been shared with us from our outstanding medical team, Denise Licata, Residential Nursing Director, and her outstanding nurses. Signs and symptoms of COVID are worth mentioning again, as I know we reviewed it earlier on in our training. Signs and symptoms consist of cough, shortness of breath, fever above 99.9, sore throat, chills, loss of taste or smell, muscle pain, and lethargic. Only essential medical appointments will continue, and all providers for appointments occurring within the next 14 days should be contacted and notified of the person's COVID status, i.e., lives with someone who has COVID or is COVID positive. All cancellations should be documented on a visit form with the date of the appointment, indicating appointment rescheduled per provider due to COVID status. For all confirmed cases, all individuals in the residence will be placed on a precautionary in-room quarantine and will remain in their rooms if the person who is COVID positive is recovering in the residence. Person-specific guidelines. If any of the following symptoms are noted, please call 911 immediately and notify the nurse. Difficulty breathing or gasping for breath, shortness of breath, lethargic, difficulty arousing, cough that will not resolve. Self-isolate for 14 days, which in a group home setting means that he or she should remain in her room during this time. He or she should have the door closed when people are in the hall or near their room as much as possible, and windows should be open for ventilation as weather allows. One bathroom should be designated for use, and others in the residence, including staff, should not use that bathroom. The bathroom should be wiped down and disinfected after each use. If the person does tolerate wearing a surgical mask, he or she should wear it at all times during waking hours. He should not wear the mask when he is sleeping or eating. The mask can be used for a full day, but should be changed each day as it becomes soiled. When sleeping, staff should remain 6 feet distance from her or him and ensure that full PPE is used when approaching. One staff should be designated for all care of the person who tested positive and should not be assigned to care for someone else who is not COVID positive. Staff working with him or her should be utilizing the PPE protective equipment as listed below. Staff providing care to the COVID positive person should use gloves, gowns, N95 masks, which all of our staff should use N95 masks, and surgical mask over it. They will also use goggles and or a face shield. Goggles can be used and should be reused by the same staff person and wiped with antiviral wipes or washed with hot soapy water after use. Staff should wash their hands before putting on any personal protective equipment and follow separate guidelines for putting on and taking off PPE. N95 masks are intended for an extended use and should be stored in a brown paper bag at the end of each day. Staff are to bring them back and forth to work each day. The mask can be replaced if soiled, broken, or if the person using it becomes ill. The staff person working with the positive person should use a surgical mask over the N95 mask, and those have been provided. The surgical mask that is over the N95 mask should be removed and discarded in the person's room before the staff person leaves the room, or if it becomes soiled at the end of each shift. A new surgical mask should be used each time you re-enter the room. N95 masks should be worn at all times. If leaving the bedroom during shift, discard surgical mask, remove gown carefully, not to have the exterior come into contact with your clothing, and leave it in the person's room with the dirty side out. If it becomes soiled, please use a new gown. Always remove gowns before gloves. Wash hands immediately following. You may reuse the gown if it's not soiled, provided it does not leave the person's room. When it is time for staff to take off the equipment for the day, it should be done by taking off the gown first, then gloves, then the surgical mask. These should be placed in a separate garbage bag in the person's room, and the gloves should be removed and placed in the garbage bag and sealed up. The staff should then immediately wash their hands thoroughly with soap and water for at least 20 seconds, or use hand sanitizer. The garbage bag containing the PPE equipment should be thrown out in the trash and outside the home once it's full. Please refer to the video training that is on the agency website that you have been trained on if you need a visual aid. The staff assigned to care for the ill person should take their temperature and pulse ox readings every 4 hours and document on the flow sheet. If the pulse oximeter reads below 90, call the RN. If his or her temperature is above 100, he or she should be given Tylenol as ordered. If the temperature is 101 or higher, call the RN. Clothing should be washed separately using hot water, and he or she should be given disposable silverware and disposable plates to eat in her room. These should be thrown away in her trash can in her room and then thrown away separately in the outside trash can. If you have any questions regarding the guidelines and/or care, please call the residential nurse, on-call nurse, or nursing coordinators. Their numbers are listed in the residence. As noted in our previous slide, there is a PPE video link, which can be found on this slide. Additionally, you can find the PPE equipment link on the Business Links page if you should need a refresher. The PPE equipment link will show you how to properly put on and remove PPE. As you can see from our picture here on the slide, the first, second, and third people are not wearing their mask correctly. The fourth person is. The fourth person has the mask secured around the nose and around the chin and fits towards the face. It's important that we wear our mask correctly so that we do not spread COVID. Here are some additional ways to keep yourself safe as well as those around you. Wash your hands frequently. Try not to touch your face, and if you do, grab some hand sanitizer. Always social distance. Stay home when you can, and avoid large crowds of people. Thank you so much for joining us today. I know that there is a lot to remember, but I know you can do it. If you have any questions or concerns, please feel free to reach out to your assistant director or house nurse. We are here to help. It is greatly important that everyone follows the guidance provided in this training for the safety of everyone. Our ADs and nurses will be spot checking during their visits to ensure that everyone is doing their part. We will work with all of you to ensure that you have the tools needed for success. But anyone who does not follow the procedures and protocols in place will be addressed, as the safety of everyone depends on us all working together. Thank you all. Please stay safe and have a great day.